Welcome back. This is World Insight. I'm Tian Wei. China has gone full steam with mass COVID vaccinations, with more than 800 million administered doses across the country already. The government has announced its plan to vaccinate 40% of its 1.4 billion people by the end of June. Is the nation on track to meet vaccination targets? Meanwhile, the WHO, World Health Organization, has approved China's Sinovac COVID vaccine for emergency use recently. It is the second Chinese vaccine to gain WHO approval after Sinopharm made the cut last month. The WHO approvals do give assurance the two vaccines meet international standards for safety and efficacy. Earlier, I talked to George Gao Fu, the director of the Chinese Center for Disease Control and Prevention, for more details. Let's listen in. I'm honored to be joined by Dr. Gao Fu, director of China CDC. Dr. Gao, what a pleasure to see you once again.
Nice to see you again.
Thank you for taking your time out of your extremely busy schedule these days. Let me ask you about the effectiveness and efficacy of the vaccines researched and produced in China. How is it compared to some of the others already listed on the emergency list of WHO?
As you know, WHO approved two kinds of vaccine, two inactive vaccines, now in the WHO list for the emergency use. And also you saw a lot of reports from Brazil that shows one of the vaccines works very well. Not only protect for the infection transmission, but also, of course, for the death. So in general, the vaccine developed in China at the moment, shows very good effectiveness and efficacy. So in general, it's very good. In China, in total, we have 7 vaccines at the moment in the clinical use. 4 of them is already in the conditional commercial use, and 3 of them, it's at the moment, it's in the so-called EUA, so emergency use approval. So at the moment, so we have, you are talking about inactivated vaccines from 5 companies and 1 adenovirus-based vaccines from Tian Wei, and the other one is protein subunit vaccine from Zhifei Lonke. So generally speaking, the vaccine developed by China, it works very well.
Does China have enough vaccines for its own population?
So at the moment, everybody thinks you need a really good, if you want to obtain very good protection, you need some percentage of the vaccinees to be covered. So that is calculated from the basic transmission number, the whole so-called R naught, and plus the efficacy or effectiveness of your vaccines. So at the moment, you are talking about roughly about 80% of the Chinese population. That's a huge number. But at the moment, in China, we have over 500 million doses were vaccinated already. So we are on our way trying to cover that number very soon.
What do you mean by very soon?
At the moment, we think we want to have, when you are talking about a percent, we think we want to have roughly about, say, 700 million people to be vaccinated by July or August. So that's the number. And then we are targeting for early next year, we will have roughly about 80% or 70 to 80%. That means you are talking about 1.1 billion. That's a really big number.
Yeah.
This is why I'm saying we are working very hard. Not only you need to get all those people to be voluntarily being vaccinated, but also you need the production of so much vaccines there.
Does China have that production capacity?
We have the capacity, but we have to work hard.
Now, the other thing, of course, a lot of people have been talking about is the comparison between China and the United States. According to the Biden administration, by the national day, their national day, July the 4th, likely more of the American adults will be vaccinated. But what is China's timetable? And is there going to be a competition about whichever country is going to be the first to open the door safely to the others?
I don't think we have a competition for country from country to country. we have a competition with the virus. So if, as I said, if we don't have enough people vaccinated, the virus will take over the world. So it's so obvious. I don't think we are talking about the competition from country to country. So let's put it really, you need, calm down everybody. So we need to work together. So though maybe China and the US, we might cover our population, some proportion, but you need the whole world have enough proportion to be vaccinated. By then, you will open your border. But if you open your border, and the good example is, at the moment, after Wuhan outbreak, in China, so we don't have any more local virus transmitting around, but we always have the imported cases, the virus imported from outside of China, coming to China, and then we start a new community level transmission or local transmission. So that's always a problem at the moment in China. So you can say, if the pandemic is there, no country can be free of the virus. No country can be free of the transmission of the disease. So let's work together, not to compete for the country, but to compete against the virus.
Will China be able to use or want to use vaccines from other countries? For example, Pfizer, Moderna, AstraZeneca, and the list goes on. Or China prepares to mainly only use its own vaccines for its own population?
As our president Xi Jinping said, the vaccine are the public goods, so international or global public goods. So we are ready to share with everybody. Of course, we welcome the vaccine outside of China, produced outside of China. It's always there. We are discussing this. It's possible if we need anything, and why not import something? If any other countries, they need our products, why don't we just export our products? So at the moment, I think the option is always open. So from the very beginning of this pandemic, China runs our policy for prevention and control this disease for the openness, transparency, and responsibility. So we are open, in my opinion.
Dr. Gao, we understand China has been voluntarily contribute about 10 million doses of vaccines to COVAX, the platform. Of course, that's good news. But one side to offer, the other side also needs to accept. How do you see that process is going right now?
This is why you heard the news. The WHO approved the emergency use for 2 of the Chinese inactive vaccines. Of course, you offered, you need someone to accept. You're right. So if once it's approved by the WHO, so you are on the right track. So some countries in a very good position to accept those vaccines. So the whole process is still underway. So at the moment, I hope the whole process can be speed up very soon. In general, it's on the right track.
The Chinese vaccines, Sinovac, Sinopharm, has been working very well with the population, but we have also seen the latest with some people already having extra shots from their earlier 2 injections. So what do you make of the antibody, the duration of the antibody? Do we have specific numbers about that? And how are we going to proceed to the overall population next step?
Coronavirus, it's the first time for the people to develop the vaccine to be used for the human being. So we don't know and how the immune response for the coronavirus will last. The number you use for, how long it will last for the antibodies. We don't know yet. As you know, Dr. Tian Wei, the CEO of Sinopharm, and he claimed we need the 3rd injection. At the moment, this is under investigation. It's not the real conclusion.
I see.
Of course, there's a lot of reports. You have so-called breakthrough infection. So why you have breakthrough infection? That means you already have vaccinated, but you still got infected.
Yeah.
And you are a source of infection. Maybe people think, maybe because the titer of an antibody after your 2 doses of vaccination are not good enough. At the moment, I don't think we have a definitive conclusion for that. That's the option the scientists are discussing.
Dr. Gao, another area of question regarding the latest community transmission inside Guangzhou particularly. What do you make of the reasons behind it, and what is the latest investigation going on regarding all the reasons and the possibilities?
You know, after the Wuhan outbreak, the lockdown, when we win the lockdown first time, and in China we have several cases like what happening at the moment in Guangdong or Guangzhou, including Shenzhen. You know, as I said from the very beginning, because the pandemic is still there, so it's normal. So as long as you have a pandemic in the world, no country can be clean. So this is why we have Guangzhou outbreak. In my opinion, so what happened in Guangzhou this time, you know, because the place zero was discovered a little bit late, and also because you know those concentrated areas, most of the people went for dim sum, the Chinese Canton dim sum. When they are old, a little bit elderly, so they usually go for dim sum, but they don't carry their mobile phones. So it's very difficult to trace back. So at the moment, but you can say through the hard working. So we got into the steady stage. Like what happened, you look at the Beijing, Xinfadi, and Xinjiang, Shijiazhuang, northeastern areas after Wuhan. So we have so many places like that. At the moment, it's in a steady stage. I hope, I can see the future. It will coming down very soon. And you have already seen the local authority decided to have all people for the nucleic acid test. So by doing that, I think the cases will come down very soon. China has been doing very well after Wuhan outbreak. We have the relatively normal social activities, normal economic activities there. Meanwhile, we always have these imported cases causing the local transmission or community level transmission. For the Guangzhou outbreak, as you know, this time the source of the virus is a kind of a so-called the variants first reported in India. So you can see that this is exactly the virus. You can see, maybe it's imported, but we need to still working very hard to figure out the regional site, where it's imported.
A lot of things going on all at the same time. Dr. Gao, I'm sure you are very much aware of this politicizing the issue of the so-called virus origin. Now we also see the United States Biden administration trying to start 3 months investigation, quote unquote, about whether the origin of the virus coming from China. Now, China, of course, protested against it, suggesting that the U.S. should do investigation of its own and the WHO should do also investigation of the United States. Dr. Gao, as a scientist, how do you see so-called investigations like these?
I think if you want to do the investigation, why we have so much discussion about the investigation of the origin? Because we want to prevent for the next potential coronavirus outbreak.
True.
So that's quite understandable. However, for the origin of the virus, it's a scientific question. We got to leave the science for some time to figure out where the virus really originates. So at the moment, there's no evidence where the virus comes from initially. So this is, I'm calling for everybody, calm down. Let's work together to figure out where the virus originates. And China, as a scientist for myself, I'm also eager to know where the virus from. So because this will help us for the future. However, because this is a scientific question, it might take some time. Let me give you a very good example. When you are talking about the flu, after 1918, by then, even the scientists or the whole human being, we don't know what is the flu virus. The flu virus was first isolated in 1930s, first from pigs, then from human. So it always takes time. So this time, we are eager to know it, but there's no evidence. You would say, okay, it's first from China or first from any other country. Leave it as a scientific question. Leave it for the scientists to work together, to sit down. They have a brainstorm. let them have a brainstorm. They will discuss it together. They will find out, by some time when and where the virus come from. In terms of the flu, it takes about 60 to 70 years, and people figured out. The flu virus, actually, there's an ecological cycle, not just from human beings. It's from migratory birds, and to the ducks, and to the chickens, and then to the pigs or the swine, and then come to human. And then they have this circle of circulation of the virus transmission. So let's leave it for science research.
Dr. Gao, you and your colleagues at China CDC have been working through years with many of your international counterparts, including those that have been on the team for the joint research with China on the COVID-19 virus. What to you as scientists do you think are the most important things to bear in mind, given the very complex geopolitics and the political environment we're living in right now?
COVID-19 is something special. It's a pandemic. It's at the moment we have so much tension from all over the world. So everybody is worried. Everybody, because they stay at home. Some people might also already lost their job. I think that's for the public quite understandable. And then the politicians, they are trying to find something to blame something, and that's also quite understandable. This is what I'm calling let's calm down. To work together. And because for such a big issue like COVID-19, it's not only a scientific question. You can leave for the scientists, but also it's a question for the politics, for everything. Everybody has interest for that. Most of the scientists, we believe, we should work together for this science question. I think most of the politicians, they are very reasonable. Of course, from time to time, you can always have someone who are not really reasonable. That's also quite understandable. Let's really, work together. Let's call for this peaceful discussion.
Many around the world missing their friends in the other parts of the world. Many of the colleagues want to see their counterparts. Many business people need to travel. Students need to go to universities in other countries, and the list goes on. Dr. Gao, when is the world going to be able to open borders? Not just China's, but mostly be able to open their borders and interact once again, as we did before?
I don't think we have a time to work here. So we have a lot of discussions there. Think about 1 year ago, if you and me, we were sitting here together, talking about maybe by that time, a lot of people say, by now, it's already open. So because it all depends. All those strategies and discussions, they are all dynamic. So we don't know that date. However, everybody knows we have to make sure, the vaccine, we have enough people vaccinated. So let's wait and see. Make this as a dynamic strategy. It's a dynamic dialogue. So wait for the future.
I love that keyword, a dynamic one. Dr. Gao Fu, Director of China CDC, what a pleasure as always, sir. Thank you so much. Dr. George Gao Fu, Director of the Chinese Center for Disease Prevention and Control. That's all the time we have for today. If you'd like to see more, search World Insight or check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei. On behalf of the team, thanks for watching. Bye for now.